Brandy, and I work for the Doctor-Patient Forum, which I think Dr. Singer would know Claudia Morandi and Bev Shepman. I'm a pain advocate. I'm a lifelong pain patient. I was born with spina bifida, severe scoliosis. I had my first fusion at 12 years old. I'm on my third at 44. So I would like you to really talk about right now the DEA is cutting the supply once again, which they've steadily been doing since 2014. This will equal over a 70% decrease in our meds. We know their goal is 100% decrease. We need help. We need Congress to stop this immediately. Nobody wants to hear us. Mainstream media, they don't put us on TV or they heavily edit what we're saying. I know that because it's happened to me. What can we do right now? Because people are planning their funerals. Like, this is going to kill off millions of people.
Dr. Singer.
Yeah, thank you, caller. This is a real problem. If anybody's interested, I wrote a white paper for the Cato Institute 2 years ago. They could look it up at the cato.org website called Cops Practicing Medicine. And this is the problem. The law enforcement and the drug policy regime is still not giving up this idea that we wouldn't have any problems if it wasn't for doctors overprescribing pain medicines. So, like I said, we're now down to 1992 levels of opioid prescribing. And if you look at the data coming in from the CDC every year, the number of overdoses that involve prescription pain pills has been, first of all, the graph has been flat, but it's down to the very bottom. It's not a contributor to this. The latest numbers, just out from 2024, had 48,000 overdose deaths out of the 80,000 were fentanyl related. And then the second most common cause of overdose deaths happens to be cocaine and stimulants related. Then comes heroin. Prescription pain pills have been near the very bottom and have not changed. And meanwhile, they just don't want to give up the ghost. They want to keep lowering prescription pain pills. How's that been working? We've been lowering the prescription rate has peaked in 2012. That's almost 14 years ago. What's the overdose rate done since 2012? It just continues to go up. It's because unfortunately, most policymakers don't want to admit that the problem isn't doctors. We're not creating a population of like addicted zombie-like people walking around looking for fentanyl. We're creating a more dangerous environment for people who are going to continue to try to access drugs for non-medical use on the black market. And we're enriching the drug cartels. They're no longer even confined to places like Mexico. These are transnational organizations now that coordinate with other parts of the world. For example, the Mexican cartels partner with the Albanian drug cartels and the Balkan drug cartels, and they're opening up shop in places like Ecuador with the Albanians. This is what our prohibition is doing. We're really helping to enrich these evil people, and at the same time, we're making people who need medicine for pain suffer, and people who just want to use recreationally, even if, I'm not saying it's a good idea, but if they want to and they're going to, we're making sure that when they do, they're going to be more likely to die.
We'll go to Tony.